so for 2 years, I worked in the South Bronx and also in Bedford-Stuyvesant in Brooklyn doing primary care internal medicine in sort of a repurposed supermarket, as well as in a repurposed laundry room that was in the basement of housing projects.
Intramural is dispersed amongst behavioral and social sciences research. Intramurally is dispersed among all of the various institutes and centers. So for instance, there's obviously a large effort in neurosciences research, and a lot of that is more cognitive neuroscience or behavioral neuroscience oriented in nature. There's cardiovascular work that's being done, especially on cardiovascular risk factors and those types of things. There's work in behavioral genetics, looking at how genes and environment interplay and interconnect and interact. There's work in drug abuse and in monitoring of substance users and the context of their behavior and when and how it occurs. And I think that's an important component of what we want the intramural program to do, is to cover everything from some of the basic neuroscience work that needs to happen all the way up to more contextual sort of things where the environment and the community and the organization and the context of the behavior are particularly important.
Many investigators might characterize as risky because the outcome of the research is uncertain or because there are many logistical barriers. My extramural colleagues and my extramural collaborators have difficulty undertaking long-term projects because of the uncertainty of their funding. Although intramural researchers have lots of similar concerns, we tend to have greater predictability in the resources that are allocated to us for doing these projects.
So we have several new initiatives that are ongoing within my section. The first is our Families Share project, in which we're developing a web-based application that will represent a research infrastructure for looking at how families communicate about and share information with regards to their family health history. This project not only will provide this, infrastructure that will allow us to look at patterns of communication within that network system, but it also is a repository for family members to collect and keep and validate their family health history jointly with each other. Our next phase is to look at some of the biomarkers that are related to stress and inflammation that may result through caregiver burden. In addition, we're adding in some measures of genomic resilience as well as genomic sensitivity to stress. And we're looking at that at a network level. So for example, we might be considering parent dyads in the context of parents providing care to children with inherited conditions, and looking at whether or not one parent has a genotype that puts them at particular susceptibility to a stress response, and if they're partnered with a parent who does not have that genotype, are we seeing a different interactive and coping style within those couples than parents that both may share an increased sensitivity to stress?
So what we would like to do next in our research is to actually turn our electronic diaries into a treatment delivery system, provide just-in-time treatment. We know that substance abuse with the healthcare system can only be so long, but people remain at risk for relapse for very long periods of time. It would be great if people could just keep that clinician in their pocket, maybe could alert them to when they're going to be at risk for relapsing, and to provide them some information that could help them resist. Even though my background is from a medical and pharmacological perspective, as I got more experience in the drug abuse field, it became really apparent that behavior is key to this disorder. And so we can't just study it from a medical perspective. We actually need to look at that behavior and look at the context of that behavior. And so we have to include all of that in our studies. In addition, when we think about substance abuse, the most commonly delivered treatment is actually a behavioral treatment. And so to deliver that treatment and have it be most effective, we need to understand the behaviors.
Include the computational areas. And also, there's always a new technology coming up. And therefore, keep your mind open and then apply those new technology so that we can learn something new.
I came in on day one, and Dr. Powell Wiley explained to me the projects and explained the different facets of each and asked me what my interests were. And by day two, I was headfirst into that project and really taking the primary role in that. And I don't think you can really find that experience anywhere else. And I think the mentorship that's provided, the one-on-one interaction with your principal investigator is really unprecedented. And I don't think you can get that fresh out of an undergraduate education like we have. And I think the opportunity to really have the epidemiology and the social research and then implementing it in the community is something unparalleled to many other labs and many other experiences.
My role is to supervise fellows and to direct the research on motivation and emotion and reward. And more and more I'm realizing that it is very important to encourage fellows, motivate them, and then to be encourage them to be independent and think their own.
If I could give some advice to other researchers in this particular area, or particularly in trainees who are interested in this area, it would be a couple things. One is get the best training you can and get the best mentors you can. Find an individual who has trained students before and stick with them. The second thing is that research these days is no longer a solo endeavor. Research is really best done because the medical field has gotten so complex that no one person can encapsulate all of the nuances. Research has really become a multidisciplinary operation, a multidisciplinary endeavor. And so you need to be comfortable working in teams, you need to be comfortable developing teams, you need to be comfortable figuring out how to dole out credit, responsibility, workloads. All those things are very important, but that's the way research is going these days.